So I knew that with public health, it was going to be a lot of like research. It would be more of like the macro stuff, some like evaluations here that would allow me to do more one-on-one interaction. But I knew that a master's in public health was not a clinical degree, and it would allow me clinical practice. And even though I dropped pre-med and didn't want to be a doctor, I still knew that I wanted to do clinical work in one way or another. And so I've always gravitated towards cognition and psychology and behavioral health and all of that. And I learned through that professor whose office hours I went to, and he's like, you should get an MSW. I learned that social workers can do therapy too. And social workers can work in hospitals, and I would be able to do stuff similar to Okizoo, but as a job, as a medical social worker. And so I was like, great, I'll do both degrees, and then I can have a little bit of both.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 61. Hi everyone, Omari Richards here. Thank you all so much for joining me once again. Housekeeping items, be sure that you're subscribed. I greatly appreciate you subscribing. It helps the show get out to more people and shows the algorithms that people are enjoying this. And then with that being said, make sure that you're commenting, you're liking, you're reviewing, you're leaving a comment if you're on YouTube. Definitely leave a 5-star review as well. And be sure to share it with a friend because I definitely know it's helpful to other people in public health. And if you want to support, you can go to buymeacoffee.com/the PH Millennial and support that way outside of those other ways you can support. And today's episode, I enjoyed it a lot. I know that I dropped a post a couple of weeks back about informational interviews, and this interview has a lot of information around that and how this person uses it to leverage where she is today and just continues to leverage that some more. And just some great insights about MSW and MPH dual masters, which is something that someone asked about in a question on Instagram as well. So let me just stop talking and I'll get into this interview. So hope you enjoy. Today, we have a recent Master of Social Work, Master of Public Health graduate from University of Washington. She got a Bachelor's of Arts in Neuroscience at Boston University before going on to her dual MSW and MPH degree. She currently works as a Research Interventionist at Kaiser Permanente, WA, I'm guessing Washington State, Health Research Institute. We have Vi Tran, MSW, MPH. Welcome to the show.
Hi, thanks for having me.
Yeah, it's my pleasure. It's my pleasure. I know just before this, you're saying like you followed my page 48 hours before I reached out for you to be on the podcast. So this is a quick connection.
Mm-hmm. Yeah.
Well, I'm glad to have you on the show and to display your MSW, MPH and how that all came together for you. So how you doing? How you been coping during these times?
I've been doing pretty well. Before we started this, I told you I'm on crutches right now, so I'm working on that at the moment, and still working from home until probably the fall. And so overall, I'd say I've been pretty busy during the pandemic, finishing up grad school and such. So now I'm navigating full-time work.
Yeah. Okay. Awesome. And I hope that you get off of those crutches sometime soon.
Thanks.
You're welcome. So how do you identify, and then tell us a little bit about your personal background?
So quick overview about me. So my name is Vi Tran. My pronouns are she, her. And a bit about my background is, I think you did a really good job at introducing me. So I grew up in the Bay Area, moved out to Boston to go to school. And while I was in my undergrad, that's when I started learning more about public health and what that could mean and what that looks like moving forward. At BU, they had a really strong public health minor program, and the master's in public health program there is very well known. And so got interested in that, but decided that being across the country from my family was a little bit too challenging. So decided Seattle was close enough to my family, but still gave me a new place to explore. And I've been here. This is going to be my 4th year, I think.
Awesome. So going from coast to coast to coast.
Mm-hmm. Yeah, who knows where I might end up next.
I'd love to hear it. What does public health mean to you?
That's a great question. I think, at least in the last year and a half, the definition of what is public health has changed a lot for me. I see that public health is anything and everything. I think at the end of the day, whatever you may be working on has ties to public health. So it could be looking at like transportation, it could be looking at healthcare, it could be looking at policy. And at the end of the day, like if you're working with people in some degree, there's going to be a public health component. Um, yeah.
Yeah, absolutely. I agree. Like, if you're working with people, there's going to be a public health component. Hopefully, more people can see that, and we get more public health people in all different sectors and fields around the globe.
Yeah.
So tell me. So you said you're from the Bay Area, but then you got your Bachelor's of Arts in Neuroscience at Boston
Mm-hmm.
University. So why do you, first of all, did you go into your bachelor's with within neuroscience? Do you start off as a neuroscience major, and why Boston University?
Yeah, so I'll start off with why Boston University because I don't have like the best answer for that. I was in high school and I heard the song Boston by Augustana for the first time. And I think it was like a time in high school where I was just like looking for a new start, like looking for some change in my life. I grew up in the Bay Area, but I grew up in a very small town in the Bay Area. And so I didn't know what else was really like out there for me. And I heard this song and I was like, that's what I want. I want to start a new life, which is like the chorus of the song. And so I got hooked on Boston when I was 14 years old. And for some reason, Boston has like 20 universities within a mile. But I was just tunnel vision on Boston University. There's no fun story of me visiting and falling in love with the campus. There's no like, oh, like the research that they do is amazing, which it is, but I was 14. I had no idea what research even was. I was just like, yeah, I'm going to go to Boston University and it's going to happen. I applied early decision. And what I really liked about going there was they let you change your major as often as you'd like. I know like when I was looking at schools, I already picked my school when I was 14. When I was looking at other schools, I saw that a lot of them, you have to apply into majors, or if you got one, it was hard to switch. And so I started at BU, I was like environmental earth sciences. Um, and then thought about it more and I was like, I like to hike. That's it. Um, and then I took a psychology class my senior year and really enjoyed it. But I specifically liked what they were learning about the brain and like the different areas of the brain. So I was like, okay, let's study neuroscience. And then throughout there, I was neuroscience and pre-med. After 2 years, like I actually don't really want to be a doctor. And for a while, I went back and forth. So I was psychology. I went back to neuroscience. I picked up a public health minor along the way. And finally, I got to a point where if I wanted to graduate in 4 years, I had to decide what to study. So I stuck with neuroscience, did a public health minor on top of it, and ended up being really grateful that I kind of ran around and ended up back where I started.
Okay, that's awesome and quite
Yeah.
fascinating. Can't believe you decided on BU because of a song when you were 14. That's wild. That's wild.
Yeah.
Oh, I
I
wonder
know.
that.
I wish it was more of like, oh, like the culture, the weather, the student life. Now it was a song.
I hope that person's getting some royalties for getting some BU students, right?
Maybe, yeah.
Yeah. So what was the reason for you not wanting to become a doctor in your path?
I think deep down I knew that I didn't want to be a doctor. I saw a lot of my classmates as we were taking like Gen Chem and like organic chemistry and all of that, just really um, I don't want to say that their work ethic was better than mine, but they just had like a different mindset of getting through it. And I like was kind of like, I'm not that attached to like the end goal so much. Like this is a lot of work and I just don't see it. Like I can't picture it in my mind. And then I did some volunteering and some shadowing. And I was like, yeah, it's not sticking. Like this is a great career and I love what everyone is doing, but at the end of the day, it just wasn't me.
Yeah, and absolutely fair enough. Fair enough. So you said you went into university as an environmental earth science major.
Yeah.
That's awesome. That's awesome. And and then you said you switched from earth science to psychology to neuroscience to psychology to neuroscience.
Yeah.
Did that like put you back in with like getting certain credits for classes to graduate on time or?
No, so I think I was both very strategic and very lucky with how I planned my classes, where I picked psychology classes that I could transfer as neuroscience major credits. So I was still not fully committed and still trying to figure it out. And then it came down to there is a neuroscience class that I really wanted to take. And the only way I could make it happen was if I was a neuroscience major again. So I was like, okay, sure. I guess I'll finish it. Yeah.
Okay, that makes sense. Okay, so when you were in Boston University, you got your research. Hold on, did Boston University live up to everything that you expected it to be?
Everything and more. I loved it. Like it was so much fun. Like I think I went through the experience that I think every college student has, especially when you move far away from home. Like I was homesick. There was a period where I felt like I had no friends. There was a period I felt like I had dozens of friends, but no one actually knew me. And yeah, there was just something about the city that I just, even when I was having a really hard time adjusting to like snow and summer rain, that's a weird concept to me still. um it was kind of like, no, like this city is what I want it to be, and like these are just growing pains. And yeah, leaving was really hard. I had to think long and hard about whether or not I wanted to move to Seattle.
Okay, and we'll talk a little bit about that in a bit. So you were a research intern at Insern. So how do you get this and what do you do in it?
Yeah, so Insern is in France. It's in Grenoble, France, and I studied abroad there the fall of my sophomore year of college. And it was a study abroad program for pre-med students, and it was during that semester where I was like, I actually don't want to be a doctor. But yeah, there was a class that we were able to take called, I think it was Introduction to Scientific Research. And at that point, I was still trying to figure out if I wanted a PhD in neuroscience. At that point, I was like, oh, maybe a doctor, maybe a PhD. I don't really know. Let's do research and see if we like it. So I did research with the lab over there. We were working on breast cancer. It was very cellular bio based. So I was doing like culturing cell lines and doing other stuff with chemicals and such. And it was really fascinating. I liked it, but I was also like, yeah, I'm not going to get a PhD in cell bio. Yeah.
Well, at least you learned that you found something that you didn't like and
Yeah.
forward.
Yeah, I was exploring so I did breast cancer research because I was exploring the idea of maybe doing oncology or working in some type of specialty field. And I was like, well, if I want to do oncology, I need to know what cancer looks like. I need to know what they're doing in that world. And so it was a really great learning experience. And I think I learned things that I liked and also learned more about what I don't necessarily want in a career.
Yeah, and I think that's great and validating experience right there. And then after this, you led discussion groups as a facilitator slash counselor. So tell me a little bit about that.
Yeah, so I think I started with Okizoo. Okizoo is a summer camp for kids with cancer and their families, so siblings and parents as well. And I started that I think the summer before I went to France, and I was a camp counselor there. And it was again like I was like, oh, I think I want to be a doctor. I think I want to go into oncology. Can I work with kids? Really exploring that world. And so did Okaizu, absolutely loved it. I still work with them today. I still volunteer with them. And so I started as a counselor. And then once I got my master's in social work, I became a discussion facilitator, which means I meet with the kids or their siblings or their parents, and we just talk about their experience having a child in the family with cancer. And it's just really great support. And yeah, I really credit Okaizu with kind of being the catalyst for me wanting to go more into social work and doing that one-on-one work with folks.
Okay, so when you were working with the one-on-one folks in undergrad, did you know what social work was at that point in time?
No, so I remember, oh gosh, it must have been my sophomore or junior year of college. I was doing that thing where I was bouncing around majors, like no idea what I was doing with my life, just exploring every possibility that I could possibly find, which I think is so great for college, like to be really open-minded and not have a one-track mind. It was chaotic, and I think it concerned my mom a bit how unfocused I was, but I learned a lot throughout that chaos, just the madness of that. So I had a psychology class one of the weeks I was a psych major. And I went to the professor's office hours, and I really liked his class. And I specifically liked all of the stories he told of his time as a clinician. He has a PhD in psychology, and he worked in schools a lot with kids. So I went to him and I was like, hey, like, I really like the stuff that you do. Um, there's also this camp that I really enjoy doing, and it's a lot of fun, but this is all volunteer. And I want to know, how can I continue doing stuff like this and similar stuff to what you do, but make some money? Because I was like, I can't be a counselor forever. It's for like it's a couple weeks in the summer. Like that's not for everything. And so he was like, if I could redo grad school and that experience, I probably would have gotten a master's in social work. And that was the first time I ever heard about social work as even like a consideration for where my career would go.
Okay. See, it's all these like little small things that come up and pop up and show us things that we didn't know, and then lead us to the path that we are in right now.
Yeah,
It's all,
exactly.
yeah.
Oh, that was just a great idea.
Yeah. So that's awesome, because it just goes to show, like, from this one experience, like, oh, I kind of like this. I can do this full time. How can I do it full time? And then you get that information. So really asking as well. And then you were also a research assistant at the University of California, San Francisco. So what do you do in this position?
Yeah, so I got into that position because of Okizoo. I met someone there who worked at UCSF, and I was like, oh, do you take interns? Because I met a couple girls who worked in autism research at UCSF with the psych department. And so I was like, ooh, UCSF research, autism? Wait, that's like neuro stuff. I don't know much about neuroscience. I want to learn about it. So they brought me on. I was an intern there for the summer, and it was my first experience with clinical research. And I went into it wanting to learn about how clinical research works, learn more about autism, and also learn about like journals and publishing. And so one of my goals was to get some kind of citation out of it, which I did, and it was really cool.
Okay, that's awesome. And then you had another research assistant position at BU. So talk about that
Yes.
one.
So that was immediately after or it might have been 6 months after I finished up at UCSF. So I was at UCSF because it's close to my parents' house and I was home for the summer. And through that experience, I was like, okay, like autism research is kind of cool. There's a lot to learn, a lot that we don't know, and very on track with like the neuroscience ambiguity with the field. And so I knew that there is an autism research center at BU. I would walk by it all the time on my way to class. So I reached out to them and I was like, hey, like I would like to do more research with you guys, like explore this a little bit more. So they brought me on as an intern, and it was kind of the same thing. I was helping out like with recording stuff, with coding, with data entry, and just got to see more of how other labs work.
Yeah, makes a lot of sense. And I guess just knowing that you knew that there were these facilities at BU too was able to get into those opportunities is also very helpful. And how did you go about reaching out for the research assistantship at University of California?
So I think something that I've learned really well throughout college and now is just to ask for things point blank. So with UCSF, I had met two of the coordinators because they were counselors at Okizoo, and they told me about what they did. And I was just chatting with them, just getting to know people better. And then they were like, "Oh, I work in autism." I was like, "Can I have an internship? Do you take interns?" And she was like, yeah, email me in 6 months and we'll set it up. And I was like, perfect. So I put it in my calendar, and like exactly since 6 months later, I was like, hey, like, are you still taking interns? Can I please intern with you? And then the same thing, once I was doing autism research at BU, I found the PI of the lab and I was like, hi, my name is Vi. I'm interested in learning more about autism and research in general. Are you taking interns? Most of the time I'll do that and I'll get no answer, but I feel like for every like 50, I'll get at least 2 or 3.
It is a numbers game, and that's dope.
Mm-hmm.
That's dope that you took that upon yourself to reach out and really find those opportunities, because they're out there. You just gotta make sure that you're asking and following
Mm-hmm.
up as well. Putting it in your calendar and following up is
Yeah.
essential. That's
My
dope.
mom always says that if you don't ask, the answer is automatically a no. And so I was like, well.
Exactly. You end up in the same place you were when you didn't
Mm-hmm.
ask. So
And I was like, even if I like embarrass myself a little bit and I still get the no, at least there is a possibility of a yes.
absolutely, absolutely. And those no's can also turn into yeses later on.
Mm-hmm.
You never know. You never know.
Exactly.
So, were there any other takeaways you wanted to share about your bachelor's?
Ooh. Um, I think, oh, gosh, being at BU was probably the 4 years of just immense growth for me. I know it was like a big risk for moving across the country, going into a major that I had no idea anything about. And really, it wasn't easy for me. I struggled with my grades. I um, learned that I was not the smartest person in the room anymore. And that was a big reality check for me. And I learned how to ask for help if I needed it, and using resources as best as possible. And that in college is when I learned how to just like shamelessly ask for things such as internships and research experience and publications. Yeah. So it was when I have high schoolers ask me if they think I should go out of state, or if I think they should go out of state for college, I always say yes. If they can make it happen one way or another, like absolutely.
And why is that?
I think you learn a lot. I moved out when I was 17 because my mom put me in preschool and I was like 3 instead of 4. And yeah, like all of a sudden I'm 17 in the city where I have no family. I have to make friends all on my own, navigate this whole scary world, like figure out how to like deal with like finances too, and learn to get comfortable with being uncomfortable and not being able to call my parents or go home for dinner. um, yeah, and it was a lot of growth really quickly. Yeah.
Okay, and that makes a lot of sense. And it it is a lot to take on as a young adult going into a totally new environment like that. So there probably was a lot of hesitation in a lot of ways, but also, as you said, a lot of learning and a lot of life experiences that you did gain by doing that.
Yeah, I think back to it, I'm like, gosh, I was brave. Like 16 years old and I'm ready to commit early decision to move across the country. It happened, I rolled with it. And then, yeah, I think back now, like 7 years later, I'm like, wow, I was brave, but I'm glad I did it. Um,
Yeah.
yeah.
Awesome, awesome, awesome. So, so you went on to get your double masters, MPH and MSW at University of Washington.
Mhm.
So we heard a little bit about why you wanted to go into the MSW path. When did the MPH path, when did public health come into like your mind?
Yeah, so I first heard about public health during Ebola. I think Ebola hit it must have been 2014 or 2015, I think. I remember at BU, going to like a public health club talk where a professor came, they gave us pizza, and we just talked about like what was going on and what BU was doing um, about it. And so that was my first foray, and I'm like, oh, that's really cool, man. Like, there's something really scary going on in the world, and there are people who are running towards the fire and want to do something about it. And I was like, that's really cool. Kind of scary, but that's okay. And then I also noticed that there were a lot of students in my major who were doing public health minors, or at BU, they offer something called a 4+1 program where you can do your 4 degrees and then add on an MPH for one more year. And so I was like, there's a lot of public health going on here. Like, should I do that too? Maybe. And then once I decided, oh, pre-med's not for me, I picked up the public health minor just because I thought it was cool. I was also a little bit panicked about what I was going to do with my life. Took an intro to public health class when I came back from abroad and absolutely loved it. It was a very generic, like, here's a little bit about everything. Here's like quick thing about odds ratio. Here's a quick thing about like HIV prevention and memos and policy, and I was like, this is fascinating. And I remember it was structured like a grad level class too. So it was one of those like once a week, 3 hours, and required like that like intellectual stamina. Loved it. It was also like 6 to 9 p.m. I was like, I'm here. I will come to every class. Can I come to office hours too? So that's where I was like, I really like public health. I think I want to get a master's in public health, because it was mostly because, oh, that's what like everyone else does. Maybe I'll do it too and see what goes from there. But as the as the minor continued and I kept taking those classes, I was like, wait, I love all of this. And yeah, I think it was a year later that I decided to do the MSW as well. And so the next step was, I was like, these are kind of cool. And I learned that a lot of schools had dual degree programs. And yeah, I think it was kind of like that same intuition that pulled me towards Boston. I was like, I need to get a double degree. Yeah, and so I applied for the MSW first. And then my first year, I applied into the MPH program. And that was my intention from the get-go.
Okay, so how does it take you 3 years to complete the double?
Yes. So if you do the degrees separately, it's 2 years each. But if you combine them, you can do it in 3 years. And typically students here at UW will take all 3 years to do both. I decided to kind of stagger it. So I finished my MSW last year. And then for my third year, I just took public health classes only. And a little bit about why I chose to do the 2 degrees, besides like intuition telling me I needed it. I knew that with public health, or this is at least my understanding as an undergrad, and I also went to grad school immediately after undergrad. I don't know if we talk about that later, but I have a lot of thoughts about that decision. I So I knew that with public health, it was going to be a lot of like research. It would be more of like the macro stuff, some like evaluations here that would allow me to do more one-on-one interaction. But I knew that a master's in public health was not a clinical degree, and it would allow me clinical practice. And even though I dropped pre-med and didn't want to be a doctor, I still knew that I wanted to do clinical work in one way or another. And so I've always gravitated towards cognition and psychology and behavioral health and all of that. And I learned through that professor whose office hours I went to, and he's like, you should get an MSW. I learned that social workers can do therapy too. And social workers can work in hospitals, and I would be able to do stuff similar to Okizoo, but as a job, as a medical social worker. And so I was like, great, I'll do both degrees, and then I can have a little bit of both.
That makes a lot of sense. So you got your MPHs in health services and your MSWs in mental health clinic and clinical. So
Yes.
tell me about the thought process for choosing those concentrations.
Yeah, so that was interesting too, picking all those concentrations at UW. So I started off as a health concentration. When I started at with my MSW, I was very set that I am going to work in a hospital. I am going to be a pediatric oncology social worker. Obviously, I am not a pediatric oncology social worker now. And so I was just like, health practice makes the most sense to me. But then with the dual degree and doing it concurrently, scheduling didn't work out. So I switched over to mental health. The classes were similar. I was learning, and I was actually going to be able to learn more about like therapeutic modalities that I just probably wouldn't have to such an extent if I stayed health practice. And so I declared that at school social work, applied for my master's in public health. Originally, I had planned on doing maternal and child health as a concentration, which is still under the health services umbrella. So the health services concentration at UW allows You can be a generalist, which means just take a couple core classes and then the rest are electives, or you can pick a specific track and you have a requirement of classes that you need. And I wanted a maternal and child health, but then a professor sat me down and was like, listen, it's going to be really hard as a dual degree student to fit everything because you're depending on when these classes are offered. Sometimes they're not always offered. And if there's an overlap, you might have to extend or go into the summer. And what you can do is do a generalist and then just take electives in those areas that you like. And so that made a lot of sense to me. And I didn't want to pay for summer tuition. I didn't want to take longer than I had to. And I also was really focused on graduating my MSW in 2020 because I wanted to be part of the graduation festivities, which were canceled. So yeah, that's why I picked the concentrations that I did. It wasn't, I think, looking back, I'm really glad that that's just how like the universe fell into place for me. But at the time it was complicated and I felt like I had no choice to pick these things.
Okay. And then you mentioned that you wanted to talk about, well, you said that you feel a certain way about grad school right after undergrad. So I'll give you the floor to share.
Yeah, I really wish I took time off. I say that to anyone who asks me. So my last quarter at UW, I was mentoring some undergrads in their School of Public Health. And it was like every week I was like, take time off, get some experience. And I say that because one, I think I was really young to start grad school. I started when I was 21, which most people like graduate college at 21 or 22. And so I just rolled right into it. And I did have some experience with both social work and public health, but I think I would have benefited a lot more of having actually like worked full time for at least 6 months to a year, just to really lock it in that this is what I want to do. I think it would have saved me some time of that like kind of soul searching chaos that happened in undergrad. It kind of happened a little bit again in grad school. Yeah, and I think along the way, like I learned a lot of things that I think came harder for me because I didn't have that real life experience.
Yeah. Okay. Well, thank you for sharing that. And I hope that people that are listening, that they do consider taking that 6 months to a year to really discover themselves and if they want to make this investment.
Yeah. Yeah, I think it's a toss bag because where I lacked in professional skills and just being able to contribute more to discussions in class. Other things such as like taking like epi and bio came really easy for me because I still was in that school mode, and writing papers and reports came easy for me too. But yeah, I wish I took some time.
Yeah, fair enough, fair enough. So one of your positions during your MSW and MPH was a family services and mental health therapist at Accelerator YMCA. So talk about how you got that and then what you did in it.
So that was my practicum for my first year as a social work student. And so at UW, they require 2 practicums for social work students, and they require 1 for public health students. But because I was doing them concurrently, I got my public health one waived, which was great because there was no way I could have fit 3 practicums in 3 years. Yeah, so that was where they placed me. I told them in my initial interview that I was interested in working with kids. I wanted to be a medical social worker, and they placed me there. And I learned a lot about the foster care system, and what that looks like in Washington State. And it was a really good learning experience. Yeah.
Okay, that's awesome. And do you still have interest working with kids?
I think I do. It's interesting actually because I don't have children myself, and I've actually heard from a lot of folks who do work with kids and like in like a social work setting or some other setting that once they end up having kids, it's really hard to stay in that field. Especially for me, I've always been interested in pediatric oncology, so it's hard to say. I love working with kids. I think it's a really fun group. I love working with parents too. Yeah, if it's meant to be, it's meant to be.
Okay, well, I guess we have to follow up if you do have
Yeah.
kids to see how that did work out for you.
Mm-hmm.
And then you were also a clinical social worker at the U.S. Department of Veteran Affairs. So talk about that position.
Yeah, so that was my second practicum with the School of Social Work. And so my first year, I was learning about like the foster system and family systems and such, but I wanted very concrete oncology experience as a social worker, because prior to that, I had only been not only, but I was a counselor at a camp, which is, there are a lot of parallels, but it's very different once you're like working in a hospital. So I interviewed, I'd worked with veterans prior, or active service members prior when I was at BU. So there was that interest there and that connection. Got that position, and it was really amazing. I had the best supervisor who was so supportive, was really flexible and understanding of how insane school was, because I started that practicum right as during the year I was overlapping the MSW and the MPH. So it was my second year of the social work program, my first year of the public health program. So there would be days where I'd like leave halfway to go to class and come back, or like one semester I could only come twice a week, and she was just so understanding. And yeah, it was a really good learning experience. I got to work with veterans who and I was cancer care navigation. And so I worked with veterans who had really advanced or really challenging cases of cancer. And it taught me how to have difficult conversations, how to process and handle things that scare me in a hospital setting, work with interdisciplinary teams, doctors and nurses. Yeah, it was a good experience. And then COVID hit, and so my internship got cut short. And I was kind of scared to go into a hospital for a bit, if I'm completely honest.
Yeah,
Yeah.
that completely makes sense, and I think that's a reasonable and rational fear.
Mm-hmm.
So no worries there. And then I think this was also during your masters. You were a mixed methods researcher at UW. UW. I have to
UW.
I have to remember to say UW. So tell me about that.
Yeah, so that's my thesis. My thesis was a mixed methods evaluation, working with a really wonderful group in Zimbabwe on HIV prevention. And I started that the beginning of my last year of school. And yeah.
Okay, and if for someone that might know, what is mixed methods research?
So mixed methods research is where you combine qualitative and quantitative research methods. So with qualitative research, that's where, you're interviewing folks either like individually or in focus groups, just to get some really in-depth understanding of a topic at hand that numbers might not be able to give you. And then with quantitative, that's like numbers heavy. So that's math, that's statistics, surveys, and combining them together is really great, because the quantitative results can tell you a story of some sort, but if you bring in the qualitative and you mix the methods together, then you get some really great nuance and insights to help explain and explore why the quantitative might look a certain way.
Yeah. Thank you for that explanation. And I feel like there's a lot of reliance, especially for like big data sets I guess most big data sets are quantitative rather than qualitative. And that definitely outputs a certain set over, because you can't ask a survey question or facilitate a group in a certain way to get all the like culturally relevant kind of answers and responses. So that's why I just think there's so much value to having that qualitative part, because it really is a storytelling part and really capturing emotions and
Yeah,
things.
exactly. Yeah, I think qualitative just really answers the why. And I think quantitative is kind of more like the what happened?
Hmm.
What do we see?
Yeah, absolutely. And then you also had you were okay. So you began your research specialist at Kaiser Permanente,
Mm-hmm.
WA Research Institute, and this was during your masters, right?
Yeah, I was really busy that last year of grad school.
It seems so. It seems so.
uh,
Definitely. So how do you go about getting this?
yeah, so I was at we call it the Research Institute, or KPWHRI, which is also quite the mouthful. Yeah, so my internship at the VA ended. I graduated from the social work program. I was really scared of working in a hospital. So my idea of doing per diem or part-time in a hospital for for my last year of grad school, it just was giving me a lot more anxiety than excitement. So I knew just to pause on that for a bit. And so I just started applying for jobs and ended up on Kaiser's website, saw a posting for a research specialist, and I applied and I got it. And it was for the COVID vaccine trials that were happening. So I think a lot of folks in public health know that COVID kind of first catapulted in the US starting in Seattle. First cases were here, the first deaths. And so the trials ended up really starting here because they thought it might be like a West Coast only thing or a Seattle thing. And as we know, it is not. So they needed a lot of hands on deck. I came in and I worked as a research specialist, which is their title similar to a clinical research coordinator. So I was processing blood samples, processing saliva samples. A lot of the cell bio stuff that I learned from my neuroscience degree actually came into play. Did recruitment, did data entry, and so did that. And then 6 months later, picked up my thesis and was chugging along.
Okay, that's awesome. So how did you balance all of these things, especially in that last year? It seemed like you had a lot going on.
Yeah, I will say school being virtual was the best thing that could have happened because of all the things that I was juggling. All of a sudden, well, I was still working on site actually because you can't really process blood from home. And yeah, so I would go to work, and then at like 11 a.m. I'd clock off, go to class, and then clock back in and continue what I was doing. And again, I was really lucky to have really supportive supervisors who understood that I had to balance school as well as doing work. And as long as I could handle both, then they could trust me. And yeah, so there was no needing to like hop on a train and get anywhere to be in person, which was incredible.
Yeah, that is awesome. That is awesome. So your next position, I think, was either a promotion or a shift. But before we get into that, I wanted to ask more about like the MPH MSW. Looking back on it right now, do you think that like who would you say is the ideal person to do a double MSW MPH degree?
Oh, the ideal person? Gosh, I think I think I don't want to say, oh, I'm the ideal person, but I think somebody who, like me, has an interest in doing clinical work while also having like a research analytical mind, because I think both degrees balance each other very well. So social work, I learned like communication skills, people skills, how to engage really well and using different modalities as part of my research process and just general process when working with others. And then the MPH taught me the skills to help either advocate for something or to contribute to a field in some way. And yeah, I think also having the MPH really gives me, I don't want to say like leverage, but I'm going to say leverage for lack of a better word. But I have a really good understanding of health systems and kind of the nitty gritty behind what comes into play when making healthcare decisions from not only just a clinical level, but from kind of like a overarching systemic level.
Yeah, that makes a lot of sense. And do you if you had to redo it again, would you do the double major or would you do like the 2 years of MSW, 2 years of MPH, or do you think there was a benefit to the 3 year double major?
By doing both masters concurrently, I think one, I saved money.
Mhm.
So in that sense, I think it was worth it. And two, I think it was nice just to get it out of the way. I don't know if I would want to do 2 years, take a break, then do another 2 years. I think I am that kind of one person. Sorry, words. I'm that word one. I am that person who just wants to get it over with. Yeah.
Makes sense. Makes sense. Um, is there anything else that you wanted to share about your MSW MPH master program?
Um, it was hard. It was. I will say it is not for everybody. And so, like I said, if it worked for me because I wanted both the best of both worlds, so clinical skills and also strong research and analytical skills. And I know I wouldn't have been able to do it without having really supportive supervisors, having a really great group of friends, having my partner. And my biggest takeaway in doing a degree like that, because not many students do, I think in my cohort, it might have been like 6 people total, um, is that there's a big component of self-advocacy that is required just to make it work. I had a lot of meetings. There were times I would get frustrated, lots of like emails exchanged back and forth trying to make things work out. And yeah.
Okay. Well, thank you for sharing that. So then you either got promoted or shifted into this position as a research interventionist.
Mm-hmm.
I like the word interventionist for some reason. That's a very nice word. At Kaiser Permanente, Washington Research Institute. So how did you get this promotion or shift, or clarify what it was?
Yeah, so I think it's kind of a bit of both. So I did get promoted into the interventionist role, but I shifted teams at the same time. So I don't work in COVID at all anymore, which I think was a really good decision, first off, because, you know, as a public health student during a massive pandemic, and also working in COVID, I had no break from the COVID world. Like I would wake up, go work on COVID, log on to school, we're talking about COVID, do projects, it's all COVID. And so being able to shift teams was amazing. I felt like I could shut off my brain from the scariness of COVID for 8 hours a day. Um, so yeah, I was a research specialist at Kaiser, and one of the my coworkers there was coming around and watering the plants, and because, you know, everyone went home so quickly, and so there were a bunch of plants left over. So she came around and she was watering plants, and she came by me, and I like was just chatting. I think I was maybe a month or two in, and I mentioned that I just got my master's in social work and I'm working on a master's in public health, and I really like research, um, and also clinical work. And she told me that there's a position called a research interventionist at Kaiser, where you do research in a behavioral health standpoint. So a little bit about my job is that there are all these studies that are looking at ways to improve behavioral health services and behavioral health delivery. And to do that, you, for a clinical trial, you have to test it. And so they'll design an intervention and then they give it to me, and I meet with participants and I deliver the intervention and track them for however long. And so, yeah, she was like, oh, we've got this position. It does like social work stuff. They are looking for social workers, and it's research, and you know how to do research. And then she connected me with the supervisor there. We set up an informational interview. Turns out that she worked as a pediatric oncology social worker for a while, and shifted into research. Wish she had gotten her MPH as well as her MSW so that she understood research a little bit better. And so I was like, great, we have like 7 things in common. I love this. And then a month later, she said, hey, like we're hiring, here's the link. And I interviewed, I got it. And I will say I got the position simply because I was networking. Like it was, I like took a second and like talked to that coworker who was watering plants, got to know her better. And then, yeah. And because I had taken that initiative and I had done the networking and had those discussions, I got into the position, I think probably a couple years earlier than if I had just applied cold.
Yeah, absolutely, and I definitely think so as well. And having those 7 different things that you connected with the supervisor around definitely helped. That's for sure. That's dope that you're able to get this position so early on. Tell me, how does it feel to be graduated from your MSW and then your MPH the next year, and then graduating in like this COVID world? How has that been for you?
Um, I think it's I don't know. I feel like I still haven't processed it all, to be honest. Like it was just so not what I expected. Like, half of my grad program was online. But I do know that because of COVID, like that's what got me into working at Kaiser. That's what allowed me to work and go to school at the same time. And that's what allowed me to work and then very seamlessly transition into a full-time role. right after graduation. So I don't know. What was the original question?
I think you answered it. It was just asking about how has that been like being
Um,
graduating into COVID, like I guess working half your master's through COVID as well.
yeah, it was, I see both the good and the bad of it. I think what was really challenging was, so when you do a dual degree, it can be really alienating at times because you start with a cohort and then you kind of like get thrown around and fit classes where they work, and so it's hard to kind of get to know your other cohort, or so you feel like you start drifting from your first cohort, and that's exactly what happened to me. I knew that was going to happen. And so I remembered when I knew that social work stuff was going to start tapering off, I was like, this is my time to meet my public health cohort. We're going to be great friends, hang out all the time. A week later, COVID happened. And so it was a little bit lonely, I'll be completely honest. Like, doing online school with a group of folks who I really admire and I think they're so cool, but I didn't really get to know on a personal level besides group projects and seeing them in lecture. So yeah, it was hard in that sense, but I was very busy the last year juggling all of that stuff. And so yeah, I'm hoping that things, more opportunities kind of pop up for me to meet people, network a little bit more. Hopefully, once I can walk again, I can feel a little bit better about it.
Sounds good. Sounds good. We all hope that you can walk very soon.
Yeah.
So we'll be thinking of you. We'll be thinking of you. And in your current role, I guess is the traditional path to get to your role being a research specialist and then getting into research interventionist? What's the typical path for someone?
I moved very quickly. It was, I think I was a research specialist for only maybe like 6 months or so before I switched over. And typically, people will be, if people kind of like do that progression, it'll be a couple of years. But actually, for my position, most people come from like clinical social work. So they're working at a hospital or they were working in community mental health. And then they decide they want to do more research and do more like a research focused role. And then they come in to the position. So yeah.
Okay, and how what percentage of your role do you think you use your public health skills versus your master's of social work skills?
Ooh. That's a good question. I think right now, because my role is with behavioral health, I definitely use more social work skills than I do public health. However, I'm always thinking with a public health mindset. So looking at like research protocols, I look at them very analytically, looking at grants and seeing how they're written. And it gives me, I feel like I've had really good training in understanding the kind of like scientific research jargon and looking at details and keeping organized in that very public health mindset way. So, yeah.
Okay, and what are those social work skills that you talk about?
Oh, I'm doing like therapy. So it's like um, different types of modalities, ways of delivering social work, ways of delivering therapy, and like motivational interviewing skills I use constantly, which is very big in social work. Um, yeah.
Tell me more about that motivational interviewing.
Yeah, so motivational interviewing is a modality where I think it's rooted in substance use. So it's a way of working with folks who are at different various stages of change in wanting to change a behavior of some sort, and it's a great tool that engages the client or patient or participant and their clinician, whether it's a therapist or a social worker or a doctor, and just to talk with them and help them kind of like help guide them as they lead their way towards making change in some way or another. And so for me, I use it all the time. So if I'm working with participants who maybe aren't doing the exercises that they agreed to, or they're like missing sessions and canceling a lot, I can use those skills to figure out like what's going on. Like how can we work together to make this experience as best as it could be for you? Like what can we do differently, and what do you think you could do differently next time? Yeah.
Okay, well, thank you for sharing that. Thank you for sharing that. And you've only been in the role like I'm guessing a couple of months
I think I started in January.
now.
Yeah.
Okay. Okay. And where would you like to see yourself in the future?
That's a great question. So I love, I really do like research. I love exploring. I'm very inquisitive by nature. And I also really love working with people too. So really my role right now is perfect for me. It gives me that great balance. But I think, I don't know, like I am 2 months post grad. So I have a lot of, maybe 1 month post grad. No, I'm definitely 1 month post grad. Um, I've got a lot of time to explore it and figure out where I want to go next. I think I would love to work in a hospital one day. I don't want to close that door completely, whether it could be in like admin area, so like doing like health services admin, health management, or as a social worker or as a supervisor somewhere. Um, Another area of interest I have right now too is with COVID, it's been really refreshing seeing that healthcare is really embracing technology. I think that's kind of a path that healthcare was always going towards, but inching not as quickly as they could be. um, and now with COVID, things are moving a lot faster, and so I'd love to be involved some way or another with that, with adopting technology and health and like like human-centered design when it comes to healthcare.
Okay, that's awesome. And we look forward to seeing you in doing some great things and wherever you do end up, whether that be on the tech side of health and healthcare or in the research part of it. In your role actually as a research interventionist, do most people have an MPH or do they have an MSW? Do they usually have both?
um I think mostly clinical degrees. So social work, we have mental health counselors. That's for my team specifically. There are research interventionists who are nurses. I don't know about PAs. Um, yeah, so a research interventionist is quite clinical. Um, yeah, I think we do have a lot of MPHs at the institute, and they're all very kind. I reach out to all of them like, hi, can you talk to me? What do you do?
And tell me more about that actually. How do you go about reaching out to colleagues to get to know them more and things like that? What's your process for that?
So I love networking. I feel like that's such a weird thing to say. I know like networking is really challenging for a lot of people. I love it. Especially as a student and a new grad. I think that right now, and I believe like most of the listeners are students and people exploring their careers, right now is the best time to take advantage of that status. Like I know people in my position or students might feel, I don't know, for lack of a better word, inferior because maybe they feel like they don't have experience or maybe they feel intimidated talking to someone who they admire. But as a student, it is so appropriate to ask as many questions as you want, to ask for favors, ask for advice. Something that I've learned is that everyone loves talking about themselves, and everyone's got their journey that where they kind of navigated. Something didn't go their way, so they quickly kind of like readjusted and trying to stay centered. Um, yeah, so what I do is I will just send an email and say, hey, I liked your email signature on that. What is your role? Can we talk about it more? Or I'll say like, hey, like I'm working on my master's in public health right now, and I just wanted to see what careers are available for me. Can we chat? Or on LinkedIn, I'll look into people with MPHs who are doing like non-traditional roles. So like working at like Facebook or like Amazon. I'm like, what do you do? That's kind of cool. Yeah, and so I always just message and I'm like, hey, like I'm a student, or hey, I'm a new grad, and I'm kind of curious just to see what people with my degree do. Can we set up a time to talk? They always say yes. And then very rarely do I get a no, or if it's a no, it's like, oh, can you just email me? I'm like, sure, and I send 10 questions. And then so we do our call. I ask all these questions like, yeah, like, this is about me, this is how I'm interested in this is where I got here, and I just wanted to know, like, what did you do? Like, how did you get your job? Like, what was your job prior? And then I always wrap up every call with like the same three things. When I'm ready, And when I have more materials together, can I send you my resume and get some feedback? Oh, they always say yes. And I always get such good feedback too. They always say yes. And it's also kind of like, oh, like, hey, my resume, like, do you have a job? Maybe not. It's never happened for me, but
not yet.
yeah. So I'm always like, here, like, I just finished this. Can you look it over? And then I always ask, like, oh, in like 6 months or so, is it okay if I like touch base and tell you where I've been? Always say yes. And then I always make sure to ask, like, hey, like, if you could, looking back, is there anything you would have done differently to get to where you are now? Most people will say something along the lines of, like, like, kind of like what I said earlier, it was really challenging, but like, I think it was worth it in the end. Maybe if I could do things differently, but who knows? You can't really change the past. That's always the answer I get. But yeah, I love networking. It's really fun for me.
Yeah, awesome. That's absolute, like that. All that you just said, that was very, very, very valuable. So I appreciate you sharing that. And yes, people do love to talk about themselves. And when you get people to talk about themselves, they feel like they had a great conversation with you, even though they've been talking about themselves. But it's crazy psychology. But
Yeah, and I am genuinely interested. Like, I think some people kind of take networking a little bit too far, in that it kind, like, so I have people reach out to me and want to do informational interviews with me, and like sometimes it definitely feels a bit more pushy, and like you're just trying to like pull information out of me than actually getting to know me. That's not the case here. You're doing a great job. But yeah, so yeah, like I really want to know and get to know people, and I think that is like partly my personality, but also that's like the social work coming in, like, where I love learning how people are and their stories, and yeah.
okay, awesome. So moving you on to the last section of the show, the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Take time off. And trying to pursue, I would say, don't close the door on anything. So I will talk to students who are right off the bat, I don't do numbers, so I don't want to do epidemiology. I'm like, well, did you take a class? But that's also kind of scary too, because if there's a class that you don't feel confident in, like, grades like are scary, and like failing a class is really scary. I say, yeah, like, explore everything, informational interviews while you can. I mean, you always can, but as a student, like I said, you can be really nosy, and everyone's understanding about it. And yeah, volunteer. Um, and I think out of any experience, so even if you think that an experience has nothing to do with public health, so say like you're working at Target, not much public health, not much direct public health there, but in a role like that, you can learn a lot about yourself. So what do you like and what don't you like, and how does that apply to public health? So if you're working at Target, you love talking to the customers, then maybe something in like public health communication is something you can explore next. If you're working at Target, you absolutely hate stocking shelves and being by yourself, maybe like data analytics is not the way to go. Yeah, so I'd say be open-minded, ask for help, take time off.
Good advice. Good advice. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Ooh. I would say, that's such a good question. I thought about this too. You sent me this. What did I write? I took notes. Okay. Someone who wanted to get into my position. Well, first off, it's network. Like, I think there's so much power in networking. You never know when something might come up, or you speak to the right person who can connect you with somebody. But for more like, but also I have to admit, like, there is a degree to luck with networking too. For more concrete advice, I'd say if you want a career in mental health research specifically, which is kind of what I do, I would say if you are in college, cold email all of the professors in a department that does that type of research and ask if they're looking for research assistants. Um, they might pay you. I got paid as a research assistant in undergrad, which is very rare. Yeah, volunteer with populations that you're interested in, just so you can understand them better, and then you can apply that to research later. Yeah.
Great advice. Number 3, what's something you're working on improving in your life right now?
Gosh, I wrote all of this out. I'm like, where are my notes at? Goodness. Something that I'm working on improving right now. Well, one, I'm learning how to walk again, but I am learning how to be really comfortable, or not being comfortable, learning to accept more when things don't go as planned. I think I can be a very type A person at times, and have fully envisioned my next 5 to 10 years type of thing, and something goes unexpected, I can have a really hard time with that. And so yeah, that's just a lot of like self-care. That's having a lot of grace and compassion with myself, being able to sit in disappointment, but not for too long, and asking, I think asking for help is the biggest thing, especially for me being a new grad and new to my career and navigating a post, but also still in the thick of it, COVID world. Is asking questions and not being afraid to ask for favors and help in here and there.
Great advice. And if you don't mind sharing, what happened to your foot?
I was playing kickball.
It's intense.
It is. So people keep getting, like, every single game we've had. So, okay, so we're not talking about, well, maybe this, I guess this can relate to public health. We're talking about an injury.
Yeah.
So during COVID, everything went online. All of my friends moved out of Seattle. And I also didn't see a lot of people for a year. So I was like, okay, once I graduate school, once I'm done working 8 a.m. to 11 p.m. all day, juggling 17 different things, I am going to go make some friends and I'm going to build my network in Seattle. And so I was like, what do I like to do? Oh, I like being active. Ooh, I've always wanted to do adult intramural sports. I have never played a team sport in my life. Like, I like tried out for the softball team in middle school and was the only person cut. Like, that's what we're working with here. And so I like signed up for kickball. It's great. Second inning of the first game.
No.
Yeah, sprain a ligament in my foot. They're thinking like 2 months, maybe 3. So, yeah.
Intense. Well,
and then like the next week, like a girl like bruised her hip. The next week, like a guy pulled his hamstring. I'm just like, kickball is not as safe as it seems.
No, not at all. Not at all. We need to get some people out there to make sure you guys are okay.
Mm-hmm. Yeah, you can see my scooter in the back because I scooter around now.
Awesome. Well, I hope that it heals up quickly and that you're able to get back out in the kickball field.
Yeah, next season I'll be out there. I'm gonna wear better shoes.
Awesome. Number 4, professionally, do you recommend anything?
Professionally, do I recommend anything? Always keep your resume up to date. Always. You never know who might want a copy of it. Also, for, I don't know if this is professional or personal, but for anyone who is like navigating their next steps, I really love the book, The Defining Decade. It's a very short read. It's geared towards, they call them 20 something. So people like in their 20s adjacent. I guess that's also means 30s. And it's just a book about like, how can you make the most of the scariness that is the 20s and college and navigating the world, making the most of it so that you, whatever's next for you does not feel like a scramble. And that book is where I learned a lot about networking. There's like one vignette, it might be like 10 pages, and it talks about something called loose ties. I don't know if you know what those are. So a loose tie is like an acquaintance who can, or an old friend who has a connection somewhere. So in that book, it's this guy, he's like trying to find a job. He's having a really hard time doing so. And he sees a job posting, and he knows like a friend of a friend who works there. And so that's a loose tie. He doesn't really know that person very much, but his therapist, the author of the book, encouraged him to reach out. And so he did. And he was like, hey, like, I'm applying to this job. Like, what do you think? Like, can you help me out? And that guy ended up giving him a good word to the hiring manager, who then hired him because one, like, his resume showed he could do the work. Yes, he was lacking some experience, but that friend who, like, he hadn't talked to in 10 years put in a really good word for him. And so I, like, take that lesson with me everywhere.
Yeah, it sounds like an awesome book, The Defining Decade. So be sure to check it out. It'll be in the show notes as well. But thank you for sharing that. I definitely think people will take some value from that book.
Yeah, I read it every year, and every year I learn something new.
Awesome. It's one of those books.
Mm-hmm.
Yeah. Okay. Good to know. So I'll definitely put it on my book list for sure. And then, last but not least, where can people connect with you?
You can reach me on LinkedIn. I am. Do I need to say it, or is it going to be linked?
You can say your name, but it'll also be linked.
Okay, yeah. My LinkedIn is my first and last name, then 18. So, yeah, I check it. Welcome to message me there. I check it frequently. I was messaging someone today. Okay, awesome, trying to set up an informational interview.
as you should. I think it's such an invaluable thing that you can do it, especially as like a student or a recent grad. Yeah. Awesome.
Yeah. So yeah, reach out to me on there. I love working with students. I mentor on the side for free. It's just a fun thing I like to do.
Okay, we'll definitely reach out to everyone. Well, thank you so much for coming on the show. I appreciate you coming on and sharing your story and everything that you've learned throughout your double master's program. I think you're on a path to do a lot of great things. I look forward to seeing where it all takes you. Thanks so much. I had so much fun. It was really fun kind of like going through like college and like kind of how all the pieces led to me being here. It's all connected, I think. Yeah, it is. It is so fascinating, and I think a lot of people discount their story and everything that they had to overcome or do to get to where they are right now. Yeah. For me, it started with the song. I forgot about that. It did start with the song. That is amazing. That is amazing. So some housekeeping items, everyone. Thank you all so much for watching or listening. Make sure to subscribe, to leave a like, and to review. I appreciate that a lot. You can also share this with a friend or share it with anyone who you think would find some value in it. And if you do want to support, you can go to buymeacoffee.com/the PH Millennial. Thank you all so much for tuning in.